Hello, this is a selection of jeweller's loupes, and I'm going to show you which ones are suitable for dermoscopy and which ones are not. Today, I'm just showing you the equipment. To learn how to use it in more detail or to interpret what you see, please do come along to one of our dermoscopy for absolute beginners courses. Now, all of these can be used for non-polarized dermoscopy apart from this one. And I just want to talk you through the jeweller's loupe. So with non-polarized dermoscopy, what you're looking for is magnification, illumination, and an end plate so that you can put contact fluid between the skin and the end plate, which lets you see through that top surface layer of the skin. And that's what non-polarized dermoscopy actually is. This is an ordinary illuminated jeweller's loupe. And if I bring it out like this, you can see it's got a little LED light there. So I can switch it on and do this, and then I can use that to look at the skin. Now this will give me very good magnification. This is 40 times magnification and will give me an excellent view of the skin. And this is ideal for use as a small pocket-sized magnifying glass, but it's not any use as a dermatoscope because of where the illumination is coming from, just here, in relation to the end plate. So if you put some contact fluid on there and onto the skin, actually these bits would touch, so you can't get a decent contact with it, and the illumination is coming from the side. So that's your ordinary jeweller's loupe. However, there are these types of jeweller's loupe. Here's an example made by a company called Mag. These ones are not, and they come in two different sorts of ways to turn them on. So they will either have a little button that you press to turn them on, and it stays on only for as long as you press the button, which saves the batteries going down, compared to this one, which has a little switch that you turn sideways to get it to turn on. Unfortunately, that one's run out of batteries, and that again is a press one. And you'll notice that the two where you just press on them to turn it on are working much better. And that's because I accidentally left that one switched on. These ones come with different types of graticule on the end plate. And this is really important. So these ones have an X and a Y axis graticule. This one, and you can't see it so easily unless I unscrew the end plate, they're all interchangeable, but on this one, I don't know if you can see here, there are lots of different graticules, and this is for measuring the size of different stones. And so we've got lots of different graticules, and the problem with this is that they basically get in the way of what you're looking at if you're using it for dermoscopy. So you need to make sure that you get one with the graticules that look like this. Okay, so this one here has just got a straight cross going across, and this is marked in millimeters and tenths of millimeters in the crosshatch. To use these ones, and these have 10 times magnification. So to use these ones as a dermatoscope, what you do is you put some contact fluid on the surface there, you put it on the skin, and then you press the button to turn it on and look through there. You can adjust the focus by twisting them. You shouldn't need to adjust it very much. And in order to change the batteries, you just keep going and unscrew it completely. And you will see that there are some little tiny button batteries in the edge. Now, the big advantage that these ones have is they're much cheaper than ordinary dermatoscopes. And when you are using them like that, so you can put it on like that, you can hold up a camera or a phone to it. They're not magnetic. So if you have the magnetic adapter, that's not going to attach to it. So you are going to have to get your patient to hold it for you so that you've got two hands free to use your phone. And the patient will also have to keep their finger on the button if you have the one where the light is only on when your finger's on the button. If you have the one with the switch, then you can switch it and the patient just needs to hold it steady for you. But these are something that are worth considering buying, so long as you're very careful about which graticule you get. And bear in mind that the batteries don't last terribly long with these. You will need to replace the batteries. This one I also want to show you. This one comes from a company called First Check, and this is actually aimed at being marketed directly to patients. And it's a very simple little piece of equipment. And what you do, it's supposed to be single use, is you open it out like this, and this is sticky. And you stick this onto your phone camera like that. So you stick it on like that, and then you put a bit of jelly or something like that on there, and you put it onto your skin, and then you can take a photo. And the light comes in from the side, so it will collect ambient light from the side, and so it will be fairly well illuminated. But obviously it only works if you do it in a light room or on a bright sunny day outdoors. But this costs around £8. And so if you're doing remote consulting, or if you have patients who might want to do their own dermoscopy and send you their own photos, then the First Check is something which is worth considering. You have to be pretty well motivated and pretty good at taking photos to get a decent picture through it. But with a bit of perseverance, it's certainly not impossible, and it's very significantly cheaper than all of the others, and obviously doesn't have batteries that can run out. So that's just an example of some of the jeweler's loupes that can be used for dermoscopy. If you want to know more about other types of dermoscopy equipment, how to use it and how to interpret what you see, then please do come along to one of our Dermoscopy for Absolute Beginners courses. We also do intermediate and advanced dermoscopy courses and lots of general dermatology courses as well. And you can access all of these at the website, which is pcds.org.uk. So that was a selection of jeweler's loupes being used for dermoscopy.